Welcome to the 2024 Evening of Gratitude. My name is Darren Rourke, and I have the very fortunate pleasure to serve as the President and COO here at Wentworth-Douglass Hospital. 2024 has been a year that has presented many challenges to the healthcare industry as a whole, as we continue to struggle with the rising cost of inflation, the challenging labor market, and unfortunately a tortuous, rather challenging payer reimbursement market. However, we at Wentworth-Douglass, through the many gifts of philanthropy, are dedicated to serving our community. Your donations and your contributions to our health system simply mean more today than they ever have. We are here, we are dedicated to the community, and we are proud to serve the many residents of the Seacoast. We thank you for your time, your commitment, and the gift of your valuable treasure. And we look forward to continuing to serve the Seacoast for another 120 years.
We have seen an exponential increase in our delivering numbers. I have been a physician here for over 18 years. When I first started, we were at 700. This year, we should be projected to be over 1,700. We're seeing the increase in these numbers because community hospitals are now closing within the Seacoast. There are other hospitals within the Seacoast, but we are actually doing triple their numbers. So with the increase in numbers that we're seeing of our patients coming to Wentworth-Douglass Hospital, we obviously need more resources. There are many services that we provide for our patients outside of just labor and delivery, such as the strength program. We have a doula program for our laboring patients and our postpartum patients. We have a car seat program. We also provide the Safe Sleep program, which provides safe sleep sacks for babies.
Philanthropy is basically the reason that we can exist. We see patients from all walks of life, but mainly people that have difficulty seeing another provider, and we are a great resource for those who don't have a lot of other options. I know it's silly, but we're literally delivering smiles, because the amount of people that walked in with, like, I haven't opened my mouth in years, and then when they leave, like, it's big smiles all around. It's really the best part of the whole job. You can see the difference. It's really cool. Contributions made from our donors has resulted in about $17,000 worth of dentures, crowns, and other work that we've been able to gift to our patients and that they would not have been able to otherwise receive.
Philanthropy has benefited our program because we were able to create the role of the COPD nurse navigator, somebody who is a direct contact for our patients who have these chronic lung diseases and need that extra support. The patients that I work with know that they can reach out to me directly in the office and they can call me with any concerns. I can come over and see them in the hospital and work on discharge planning and identifying resources that they may need when they go home and getting those lined up. Additionally, patients know that they can reach out to me and I'll work on getting their medications approved or making their access a little bit easier.
For 2024, we launched the Courtesy Patient Shuttle, and it's been a huge success. And the reason for that is we received some negative feedback from patients about difficulty finding close proximity parking and being able to ambulate from the parking garage to the cancer center to the main hospital. The Caravan program began here at Wentworth-Douglass Hospital in 2000, the winter of 2000, and it started with 1 van and 2 employees. In 2024, we have 11 vans and we have 21 employees. In 2023, we transported approximately 9,000 patients. In 2024, the service is on pace to do 17,000 patients.
Our biggest gap that we're facing right now is that we experience food insecurity, lack of transportation, barriers to housing, safe caregiving. And with the foundation's support and donors, we've been able to meet those needs and allow people to come to us and really trust that we can connect them to their goals and help set individualized plans that would then meet their needs in the outpatient setting.
Yeah, we also are able to provide track phones to families that have safety issues to connect with, like Haven or different IPV, intimate partner violence services, or call 911 if they need to.
A lot of times these families are looked at as not providing the care that we expect and that we want. And really, if we can help provide them with the resources that can make them stronger, they can then access better care and they can come back to us and trust that we want to help them and we want to be able to provide care to them moving forward.
One of the ideas that was floating around early was the idea of reaching out to the teenagers in our community and setting up some sort of career internship. And as soon as we heard about that here at the center, we were extremely excited to jump on that and figure out how can we go out into the schools and let the schools know we'd love to have them come in. I think they come in and they get to see really what a team it takes to provide care successfully for just one patient. Those interns are actually provided a branded Wentworth-Douglass Hospital vest. Those vests were made possible by your donations. I can tell you that when each student puts that vest on, there's a sense of pride that they're part of something special. I thank you for your generosity, because without that, this program would not be possible. The hope is that we inspire students to have a career in healthcare, which helps them become a better member of our community and a better member of our team here at Wentworth-Douglass Hospital.
We are really grateful to all of our donors.
Without your support, we would not be able to meet the needs of our patients and community. We look forward to all the opportunities in the years to come working together and helping our patients become healthier and stronger.
On behalf of the transportation team and the patients that depend on our services, I wholeheartedly thank you for your generosity and support. Without you, none of this would be possible, and our programs that we provide our patients and the programs the patients desperately need would not be possible. So with that, I thank you.
Your donations are really why we are able to do what we do at the Dental Center, and it is 100% appreciated, not only by us, but by all of our patients as well. So thank you, thank you, thank you.
This position would not have been possible without our generous contributions from our donors, and it is an honor to be in this role and providing this service to our patients, so thank you so much. The patients of Wentworth-Douglass are significantly benefiting from them.
These additional resources would not be available for our patients without your generous contributions to the Women and Children's Center at Wentworth-Douglass Hospital. We thank you for that.
Well, thank you so much. As you can hear from all of our providers, the amazing impact that your gifts have had. Your gifts to Wentworth-Douglass Hospital stay here, stay local to do the most to support our staff, our caregivers, and most of all, our patients that benefit from your generosity. So thank you again.